So this presentation is based on health and how stress can affect your body. Are you feeling tired a lot of the time? Does it sometimes feel like it's hard to get out of bed in the morning? You could be suffering from some form of adrenal fatigue. Are you feeling more tired than usual? Are you wanting to hit that snooze button more than once? You have given yourself enough sleep but still tired? Are you feeling like it's getting harder to control stressful situations? In modern day society, we try to keep up with demanding jobs, long hours, family life, social life, and extracurricular activities. Sometimes our bodies just get overloaded, and no matter how many times we try to recharge our batteries, it just seems to not be effective enough. You could be experiencing some form of adrenal fatigue that can often be missed and without proper treatment can cause some health concerns. Hypothalamic pituitary adrenal axis, otherwise known as HPA, which has traditionally been seen as the body's stress system. It controls levels of cortisol and other important stress-related hormones. The HPA axis is generally underactive in people suffering from chronic fatigue syndrome or burnout. There are various physical and mental symptoms associated with these conditions. HPA axis is responsible for regulating many of the hormones, nervous system activity, and energy expenditures in the human body, as well as modulating the immune system and the digestive system. Endocrine response to stress. Any stress lasting longer than a few minutes results in increased levels of cortisol being released from the adrenal cortex. The release of cortisol is controlled by the paraventricular nucleus, or the PVN, of the hypothalamus, activated in stressful or physiological changes. PVN releases the CRH hormone in response to stress. CRH then acts on the pituitary gland, causing it to release the ACTH hormone, which in turn causes the adrenal cortex to release cortisol. CRH and ACTH are released in short pulses, each of which cause a roughly 15-minute sustained release of cortisol from the adrenal cortex, which then has a half-life of 100 minutes in the blood. The combined system of CRH and ACTH cortisol release is referred to as the hypothalamic pituitary adrenal axis, or HPA axis. Positive and negative feedback occurs at various sites in the brain to ensure that cortisol production stays within certain bounds, depending on current requirements and stress levels. Prolonged release of ACTH causes the adrenal cortex to increase in size, presumably to cope with a greater need for cortisol production, whereas long-term ACTH deficiency causes it to shrink. This is just a diagram to show you what we just talked about, how the paraventricular nucleus releases the CRH hormone, acts on the pituitary gland releases the ACTH hormone, acts on the adrenal glands, and then the release of cortisol, and so forth. The result of the HPA axis activation is to increase levels of cortisol in the blood during times of stress. Cortisol's main role is to release glucose in the bloodstream in order to facilitate the flight or fight response. It also suppresses and modulates the immune system, digestive system, and reproductive system. Another important hormone released by the pituitary along with the ACTH is beta endorphin, a morphine-like hormone. This is released when we have a pain response. They are released together in response to CRH stimulation by the hypothalamus. During normal, non-stress situations, a certain level of cortisol is maintained in the bloodstream. There is a circadian rhythm of ACTH and cortisol release, with the highest levels occurring around 8 to 10 in the morning and the lowest levels around midnight. The circadian pattern of cortisol release is controlled by the suprachiasmatic nucleus, or the SCN, of the hypothalamus, also known as the body clock. The SCN helps regulate the sleep-wake cycle. Nerve signals from the SCN causes the paraventricular nucleus of the hypothalamus to release pulses of CRH roughly once per hour, resulting in the HPA axis activation and cortisol release. There are also direct links between the SCN and the adrenal gland itself, bypassing the HPA axis through the sympathetic nerve fibers, causing the adrenal gland to become more sensitive to ACTH stimulation during the morning, further adding to the circadian pattern of cortisol release throughout the day. These interactions continue until your hormones reach the levels that your body needs, and then a series of chemical reactions begins to switch them off. For example, the cortisol released by the adrenals actually inhibits the hypothalamus and pituitary, so they stop sending signals to produce more cortisol. This is just one of the automatic switches that we call the negative feedback loops. This is a video on the stress response.
The stress response. In stressful situations, the body switches on its autonomic nervous system and neurobiological processes in an attempt to maintain homeostasis. The body is prepared for its reaction to stress. In the brain, the hypothalamus is connected to the pituitary gland. The hypothalamus, stimulated by the sympathetic nervous system, releases the hormone corticotrophin-releasing factor, CRF. The CRF activates the pituitary gland to release the adrenocorticotropic hormone, ACTH. This in turn alerts the adrenal glands. The adrenal glands are located on top of each kidney. The ACTH from the pituitary gland stimulates the adrenal cortex to release cortisol. At the same time, neurons in the hypothalamus signal the medulla to release epinephrine, adrenaline, and norepinephrine, noradrenaline. These hormones then push the body into hyperalertness.
This is also a diagram just illustrating what the video explained, what your body does and the hormones it releases during times of stress. Severe adrenal fatigue. Signals might still get sent from the hypothalamus to the pituitary gland and from the pituitary gland to the adrenal glands, but when the message reaches your adrenals, nothing happens. The adrenal glands have become so depleted that they are unable to release or produce the hormones that you need to react to stressful situations. Our body constantly needs the hormones that the adrenal glands produce. When the adrenals are worn out, hormone levels begin to drop. Other parts of the endocrine system attempt to compensate, but only leads to lower hormones and neurotransmitter levels elsewhere. Symptoms are usually constantly tired and lethargic. Symptoms associated with HPA dysfunction and low cortisol. Here's just a chart that I put together quickly about some symptoms you may experience if your body has low cortisol or the HPA axis isn't functioning as it should. Generally you feel weak, very tired, sometimes low blood sugar, muscle and joint pain, headaches, dizziness when you stand, usually because your blood pressure is low, your appetite changes, some weight loss, abdominal pain, nausea, vomiting, irritability, sleep disturbance, and so forth. Conditions that can result of HPA dysfunction, it could be OCD, panic disorders, usually you're pretty anxious, sometimes diabetes, obesity, anorexia, post-traumatic stress disorder, chronic fatigue syndrome is a big one, fibromyalgia, and so forth. You can read there. So here's a diagram on symptoms impacted by chronic stress. So if we're repeatedly exposed to chronic stress, it's going to impact us in these such ways. Neurotissue health, poor sleep, can't fall asleep, we're not getting enough sleep, mood quality, depression, anxiety, fear, panic, unsure why you're depressed a lot of the time, memory and learning, forgetfulness, concentration is off, procrastination. It can also affect your endocrine function, pancreas, thyroid, feeling cold a lot of the time, androgen and estrogen hormone levels. They either are excess or deficient. fat and protein metabolism, over or underweight, mucosal barrier lining is effective, which is the defense against pathogens. So you tend to get possibly illnesses quicker, like viruses. Your immune system shuts down a bit, your anti-inflammatory responses, omega-3 and omega-6 imbalances, carbohydrate metabolism, your blood sugar usually gets hypoglycemic, or you can be hyperglycemia, so your blood sugars are either low or high. The detox, heavy metals, environmental pollutants, chemicals, and musculoskeletal health, muscle wasting, muscle weakness, bone loss, connective tissue, things like that. Okay, so how do I test for this? What medical tests can be done? Well, most importantly, you need to get your cortisol tested, which is the hormone we've been talking a lot about. The best time to get this tested is between 8 and 9 in the morning, because the cortisol should be higher in the morning, as it's trying to get your body awake in the morning. So you can see if you're deficient in that. Doctor can do some extended electrolytes, especially checking for your potassium and sodium levels, because these can either be deficient or have imbalances with that. Also, liver function test, kidney function test, cholesterol, chloride, ESR, C-reactive protein. This can rule out any autoimmune diseases. You want to get your hemoglobin A1C done, or fasting insulin to check your blood sugars. And then there's a list of all these other types of hormones you can get tested, plus your thyroid. They also say that saliva testing for adrenal hormones could be a little bit more accurate than a serum blood test. Okay, some further medical tests would be basically if some of your lab work comes back with some hormone deficiencies or elevations, or if your lab cortisol comes back elevated or deficient, your specialist or your doctor may feel that you need to go for some further testing. One of the tests they can do is something called an ACTH stimulation test. Basically, it tests the functioning of the adrenal gland's stress response by measuring the adrenal response to the ACTH hormone. This test can be done in a 2-hour rapid stimulation test. So a blood specimen is collected for cortisol before and 30 to 60 minutes after the injection of the 25 units of ACTH. The normal response is an increase in plasma cortisol by at least a certain value. A diminished or absent response is found in both primary as well as secondary adrenal insufficiency, or conditions such as like Addison's disease or any other medical conditions. I do have a lot more information on what some of the lab values could mean during these tests, but just for the purpose of these slides, I just wanted to condense it a bit. There are other diagnostic tests to help sort of diagnose maybe what kind of condition you may be experiencing with the HPA axis dysfunction and adrenal dysfunction. Some other tests, these is again just touching base on the surface of them. If you want to look them up and see what the test entails, you can. But some of the tests that your specialist or endocrinologist may want done are brain MRI, adrenal imaging, ultrasound on the kidneys and the adrenal glands. The ACTH stimulation test can be done in 2 hours, 8 hours, 48-hour options. The insulin tolerance test, and there's like an overnight type of test. Some of these tests are not always widely used. Reason for brain MRI is because some of these conditions can have a result of, you could have a pituitary tumor on the brain, so they're just trying to rule out any of those diagnosis. So I just put together this slide, just go over it briefly. Just if some of your blood work results came back and what, the levels could mean. It doesn't mean that all of these certain tests that are done either going to be elevated or deficient. Sometimes some of the levels could just be normal, but you still could be suffering from adrenal hyperfunction or adrenal hypofunction. Usually in hyperfunction, your cortisol could be elevated. In hypofunction, cortisol is usually deficient. Your potassium could be low and your sodium could be high in hyperfunction, and your potassium could be high and your sodium could be lower in hypofunction. Again, you can just take a quick look at this and see what the levels could mean. Now, if someone is suffering and it's to the point where it's, left it for a while, it can lead to, hyperfunction can lead to metabolic acidosis, and hypofunction can lead to metabolic alkalosis. Some possible diseases of the HP axis. I just sort of put together a slide of some possible diseases that can be a result of what your specialist, might categorize you in, rendering the results that they've taken from your medical test. I'm not going to go through them all. Basically, if you want, you can just pause the slide and read about them if you need to. Some things we look at is Cushing's disease. Even, some of these disorders, they can be congenital. Cushing's syndrome, these are probably things that you might have heard of before. Usually in Cushing's, your cortisol is elevated, and your ACTH could be elevated. Some other diseases, you could have adrenal tumor, and you could read there what that's about and some signs and symptoms. Sometimes there could be ectopic ACTH where there's a tumor outside of the pituitary, so not in the brain, but could be in the lung or somewhere, that's causing you to have different elevations in your blood work, such as your cortisol or your ACTH. One of the other diseases is called Addison's disease. It's usually underactive or damaged adrenal glands. So usually in this condition, your hormones are usually low and your cortisol is usually deficient. Hypopituitarism, so pituitary dysfunction or damage that leads to decrease or no hormone production by the pituitary, ACTH, cortisol, and you can read along there. So what are some treatment options for adrenal fatigue? We can talk about diet. High intake of vegetable and fruits, avoid sugars and other refined carbohydrates. Adequate intake of fiber and water, avoid caffeinated beverages. Hypoglycemics should consume small, frequent meals. Monitor your blood sugar. When adrenal hormones levels are lower, like lower epinephrine, norepinephrine, and cortisol, are combined with increased insulin levels of stress, it becomes harder to maintain blood sugar balance, especially in response to the increased demand from stress. Without adequate adrenal activity to prompt the conversion of glycogen, fats, proteins, and carbohydrates into new glucose supplies, this increased demand for higher blood sugar levels is difficult or impossible to meet. So you're going to have a drop in blood sugar, are most likely to occur around 10 in the morning, 2 p.m., and from 3 to 4 p.m. It also drops during the night. So your diet also should consist of low in simple carbohydrates and high in protein. Two kinds of foods that you're going to want to avoid or limit is simple sugars and processed foods, because they can drain your adrenal glands.
Simple sugars are foods that contain sugar, cornstarch, and foods ending in the suffix OSE, such as your fructose, dextrose, things like that. Simple sugars are also found in many grains and vegetables, such as bananas and most other fruits, mashed potatoes, carrots, beets, and bread. Try to avoid fruit juice, soft drinks, syrups, and most desserts. Sugars that is okay in small amounts includes unrefined sugars. So basically it will say raw or unheated on the label. You can handle more simple sugars if you include plenty of butter or oils such as coconut oil. You can try a ratio of 1 gram of protein per 1 gram of saturated fat per 2 grams of carbohydrate. Combination of protein and carbohydrates every few hours and before bed to avoid a decrease in blood sugar during the night. Diets for hypoadrenalism, patients are usually not salt restricted. It's because due to the potential loss of water and sodium from the kidneys, it's important to maintain this electrolyte balance. Water with a teaspoon of Himalayan salt or Celtic sea salt can help electrolyte balance, and it can also help increase blood pressure because patients with hypoadrenalism usually tend to have low blood pressure. Some ideal snack choices would be fruit, nut butters, cheese. You can increase grapefruit to help boost cortisol production if you are deficient in cortisol.
This is just a diagram of alkaline foods. If you can try and incorporate these types of foods in your diet, that can also help as well. So I'll leave that slide up there for a little bit. You can pause it if you want to read it. So now we're going to talk about a meal plan to support natural cortisol cycle. So what we briefly talked about is that cortisol peaks around 8 in the morning, just at the highest. So there's a meal plan to help support this cycle. So breakfast you want to try and eat around 8 o'clock or within an hour of getting up to restore blood sugar levels that were depleted during the night. Snack, you can have a small snack if you want, in between 9 and 10 o'clock. Lunchtime, try and eat between 11 and 12 to prevent a large dip in cortisol levels. Another snack around 2 to 3 p.m. Just because around 3 to 4 there's a natural cortisol dip around that time. So it's better to eat the snack between 2 and 3 to avoid that. Dinner around 5 and 6, in between 5 and 6 to help your body digest less food in the evening. And then another snack before bed around 9 o'clock, or an hour before you go to bed. Okay, next we're going to talk about medication and supplementation. So basically this is a slide just touching base on some of the medications that your doctor or specialist may feel that they need to treat you with if you have some hormonal deficiencies. Everything may not be here, but just touching base on some of the medications. So again, hormone replacement therapy is to correct the levels of hormones that your body is not producing. For men, testosterone replacement is used and substituted with HCG injections. For women, estrogen replacement is used with or without progesterone. Something called bioidentical hormone replacement therapy. If you want, you can look this up and read a little bit about it. But basically test your saliva and assess your unique hormonal needs and what you're lacking in. And you'll need a compounding pharmacy, one that specializes in making medications customized for your individual needs. And below is just a list of hormones if you're deficient in, and some medications that your doctor may prescribe or do to correct the levels that you're deficient in. There's also something called adrenal extract. It's natural cortisol, and it could be glands from cattle or domestic food animals used to treat the deficiency. But I did read about that sometimes not always used because I guess, years ago there was a discrepancy in one of the medications, and there was an outbreak of mad cow disease because it is using glands from cattle or domestic food animals. So something just to be wary of.
Okay, medical treatment for acute adrenal crisis. Now, if your condition hasn't been treated, or you are being treated but your body goes into adrenal crisis, it could be quite a medical emergency. Some of the signs and symptoms are like abdominal, low back, leg pain. You're usually very fatigued, confused, lightheaded. Sometimes when you stand up, you're dizzy, nausea, vomiting, very weak and achy, sore muscles. You're going to have some imbalances in your lab work, especially your electrolytes, usually your potassium and your sodium. Your heart rate could be elevated, your cortisol could be very deficient. The treatment usually is hydrocortisone injections immediately, and you'll probably be on an IV fluid, some dextrose, and replace some of your electrolyte imbalances. If left untreated, it could cause shock, coma, seizures, and death. So other treatment options too, on more the natural pathway, you can use some adaptogens. Enhances the activation of the thyroid hormone. They can be like licorice root, ashwagandha, and you can read below there. I actually have read about each of them and what are safe doses, but just for the purpose of the slide, I didn't want to go into too much detail. But if you want, you can pause the slide and look it up. So we're going to talk about vitamins and what vitamins you should be taking to help treat this condition. I just briefly talk about each vitamin, but I do have a lot more information on them and what safe doses to have and how much you should be taking, but we'll just briefly go over them. So with vitamin C is utilized by the adrenal glands in the production of all the adrenal hormones, most importantly cortisol. But stress causes your vitamin C to be used up rapidly in the production of cortisol and related stress response. So you're going to want to replace vitamin C. If you're in, severe adrenal fatigue, you may want to take around, 1,000 milligrams per day. For magnesium, it's depleted during chronic stress. Magnesium regulates cortisol. It also calms your nervous system and prevents excess cortisol. Your magnesium also lowers your blood sugar. So your vitamin B5 assists in converting nutrients from food into energy, balancing blood sugar, reducing bad cholesterol, lowering high blood pressure, preventing nerve damage and pain, and preventing heart failure. Your vitamin B6 helps support adrenal function, helps calm and maintain a healthy nervous system, and are necessary for key metabolic processes. Okay, so probiotics are always a good thing to take because it supports the immune system. It enables us to extract more of the nutrients present in the foods that we eat, allowing us to utilize the essential vitamins and minerals and maintain our energy levels and produce hormones that we need to. Phosphatidylserine improves performance, endocrine response to exercise, stress, decreased muscle damage, can lower cortisol levels. For omega-3, if we're deficient, it can cause increased inflammation, requires us an increase in cortisol production as well. So if we take this, it can help reduce inflammation throughout your body and relieve the workload placed on your adrenals. Acetyl L-carnitine is an amino acid, a building block for proteins that is naturally produced in the body. It helps the body to produce energy. So CoQ10, your body produces CoQ10 and uses it to produce energy for growing and maintaining your cells. It's an antioxidant which protects your cells from damage and plays a role in metabolism. It also increases endurance and improves recovery time after exercise. D-ribose, which is a form of sugar, will help you sustain higher energy levels throughout the day without placing any stress on your adrenal glands. For digestive enzymes, you could be lacking in some digestive enzymes due to the condition. It can cause indigestion, bloating, nausea, abdominal discomfort, chest pain, and sometimes diarrhea. If you have a decrease in cortisol, it may cause a difficult time for you to digest your food, because cortisol controls the manufacturing of digestive enzymes in the pancreas. So a good thing to do would probably be to take some digestive enzymes with your meals to see if that helps. So I just put together a slide here about other therapies and ways of recovery for this condition. Again, they're just bullet points here. If you want, you can look them up more into detail for each. But of course, the main thing to do would be try to reduce the stress or eliminate the stressor. Going to chiropractic or acupuncture and massage therapy is good for rest and relaxation and for muscle aches, joints, and pain, and to help with the stress. Neurofeedback, which is also known as neurotherapy, it's a type of brainwave training. So the practitioner will use special sensors on your head, and this will gather some brainwave activity and gather information about, why an individual may be having clinical symptoms based on what's happening in the brain. So states of neurological, physical over-arousal or under-arousal can contribute to why a client may be manifesting symptoms like, such as anxiety, depression, OCD, attention deficit disorder, and a variety of other stressful conditions. Once the information is gathered, neurofeedback can be used to track brainwave activity and train the brain to operate more efficiently by providing visual and auditory feedback to the client as the brainwave patterns improve and self-regulation occurs. Other therapies would be somatic therapy. This is like a psychotherapy. It encourages communication of experiences between the mind and the body. It allows us for a greater understanding of the issues and enables a sustained movement towards improved health and well-being. Exercise, you're going to want to do heavier exercise in the morning or early afternoon when your cortisol production is at its peak, and lighter exercise such as walking or gentle stretching, such as restorative yoga. It's usually better in the evening. Exercise also helps with depression, increased blood flow, normalizes levels of cortisol, insulin, blood glucose, growth hormones, thyroid. If someone's in advanced stage adrenal fatigue, you should actually avoid vigorous exercise because your cortisol and your other hormones could be very deficient. Other ways would be, counseling, seeing a therapist too could help. Rest and sleep is very important for this condition. Be good to try and get to bed by 10 p.m. as the adrenal glands kick in for like a second wind around 11 at night to about 1 in the morning. Cortisol levels rises to its peak from about 6 to 8 in the morning in order to wake the body up. If you wake up too early, this will only increase stress on the adrenal glands, which you will have to produce more cortisol when it's already exhausted. So things to monitor in this condition would be to monitor your blood pressure. Decrease in aldosterone, so that's a hormone, and the cause of adrenal fatigue can actually cause you to have very low blood pressure. So you're going to want to compare two blood pressure readings, one lying down and one while standing up. So in a supine position, in a lying down position, you're going to take your blood pressure, so lie down for about 20 minutes and take your blood pressure, and then stand up and immediately take your blood pressure. If the blood pressure is lower after standing, this is a cause of hypoadrenalism. Your heart rate will increase or become irregular after you stand up and attempt to get to your blood moving. So your heart will, be higher than what it was when you were lying supine. In normal adrenal function, your increase in blood pressure, you should have an increase in blood pressure in a standing position in order to push the blood to the brain. You're also going to want to monitor your blood sugar because people with adrenal fatigue or hypoadrenalism can tend to be hypoglycemic, so you can tend to have low blood sugar. And just some references. So remember, take time to yourself so your body can recharge and rejuvenate. Don't forget to subscribe.